Hi, everyone. Welcome to Brain Talks. I'm Deborah Kan, founder of Being Patient. Two-thirds of all Alzheimer's disease cases are women, and science is just beginning to look at gender when it comes to brain health. Well, today I'm happy to have with us Rebecca Nebel. She's the director of scientific programs at the Society for Women's Health Research, joining us from Washington, D.C. Dr. Neville, thank you so much for joining us.
Thanks so much for having me. I'm happy to be here.
So let's just start with first and foremost, what is it, do we know why women are more susceptible to Alzheimer's than men?
Yeah, so I think there's two different things happening right now. We know that women live longer, and so prevalence-wise, that's why we see, for the most part, that's one of the biggest reasons why we see more women with Alzheimer's than men. But there is some studies showing incidence, so how many new people are getting Alzheimer's every year. And depending on the geographic area, there's not as much of a difference between that. So I think one of the reasons that we're seeing so many more women is a lot from just the fact that they live longer than men, and we'll see over the next decades or so what happens with regards to incidence as well.
So as I understood it, though, originally a lot of people thought that it was, in fact, that women live longer, but now science is really trying to delve into actually looking for a reason other than the fact that women live longer. Is that true? I mean, is science kind of looking at kind of just gender differences? I mean, let's face it, men and women are a lot different when it comes to our chromosomes.
Yeah, so I think that it's definitely something that's happening, and it's definitely something that we need to think about, regardless of whether there is a difference in incidence, because we know that the disease, there are different risk factors for men and women. The disease can progress different, and so even if the same exact number of men and women have Alzheimer's disease, it's important to look at sex differences, and we can see how that has been helpful in other areas like cardiovascular disease, where it's the number one killer for both women and men, but we know that women and men show different symptoms when they're having issues, and they respond to treatments differently as well.
So are we looking into, for example, let's take cardiovascular disease. I mean, we've been told many times what's good for the heart is good for the brain. A lot of researchers are looking for that interaction between the heart and the brain. So if you take something like symptoms of cardiovascular disease, what are some of the key differences there?
So I think right now with cardiovascular disease as it relates to dementia, research isn't, we know that there are risk factors. We just don't know, things like diabetes and things like that are risk factors for Alzheimer's, but researchers haven't quite yet started to look at differences between men and women with relation to how it impacts dementia later on. One example that we do know that some research is pointing towards is pregnancy. There are things that happen during pregnancy, like preeclampsia or hypertension disorders, are shown to be associated with dementia later on, and they also increase risk for cardiovascular events.
So, and that was, there was a very recent study, I know we wrote about it this week on Being Patient, about preeclampsia and how it does elevate your risk for dementia later in life. But what about hormones? I mean, I know that I've interviewed scientists who are tackling the role hormones play, particularly when women reach menopausal age. they're looking at the sudden drop in estrogen and how that creates an environment more conducive for things to go wrong. Where is research now? What have we determined about hormones and women and their brain health? And what more do we need to know?
Yeah, so we definitely need to know a lot more. But what we do know is that menopause is, this critical time. There seems to be this transition in metabolism in the way that we're using fuel, and that might remodel the brain and ultimately cause degeneration. Things we do know is that women who have had surgical menopause, meaning their ovaries have been removed or they've just reached natural menopause at a much earlier age than is average, they're at increased risk for dementia. But when you add estrogen therapy, when those women take estrogen therapy until the age of around 50, when the average age of menopause is, that risk is negated.
Right. And so, we've talked a little bit about pregnancy, menopause. So, the exact relationship with hormones and hormone levels in the brain, is that determined yet?
I think there's still more research that needs to be done to kind of figure out exactly why menopause or things that I was talking about earlier with pregnancy, how they're exactly increasing risk. I don't think those exact mechanisms are known yet.
What about depression? We know from other studies that women are more susceptible to depression than men, although both sexes do experience depression, higher incidence of depression. Has research yet tackled the relationship between, we know, people who do suffer from depression, it raises their susceptibility to dementia. So do we know anything about depression?
I think what we know about depression is that it is equally impacts men and women as a risk factor for Alzheimer's, but that because, like you said, it's more prevalent in women, this creates more susceptibility for women overall. And there are other examples like sleep apnea, which can cause cognitive impairment later in life, which is actually more common in men, but it is equally a risk factor for men and women. It's just more prevalent in men.
So, what's becoming clear too today is there's a lot more research that needs to go into this topic. Where are we on the research front? Are scientists taking gender-based differences seriously? And is there really enough research going on to determine any of these uncertainties?
Yeah, so I think research is starting to look at sex differences, and the NIH is now mandating that researchers use both sexes in their studies, or if they're not, they need to justify why. So I think that's a great first step. But the problem is that we haven't quite gotten to some of the answers. Myself, along with some other researchers in a Alzheimer's program that we have at the Society for Women's Health Research, recently wrote a review where we kind of discuss what we've been talking about today, but also highlight some areas for future research regarding looking at sex differences in Alzheimer's disease.
Is there one particular area where research should focus on first, given what we know today?
So we outlined 12 different areas, but I think one of the main things is that we don't understand how all these risk factors and how hormones are affecting risk over the lifespan. So they might be exerting their risk at different points in time, and so we need to do more life course and do more longitudinal studies to figure some of that out.
And it really wasn't until very recently that science started to think, I mean, not only Alzheimer's disease, but like women haven't been I mean, it used to be clinical human studies, clinical trials were done only on men. Is that right?
Yeah, so up until 1993, women were actively being excluded from clinical trials. So it's been about 25, almost 30 years since then. But, you know, up until that point, almost all research was exclusively on men. So we have a lot of catching up to do. And that's put women at more of a health risk because there's just a lot of unknowns about what is happening in women.
Absolutely. And I mean, and that's astounding because 1993 wasn't that long ago. So if you think about how long research has been going on and the fact that only now women are allowed, in recent years, since 93, women are being put into trials. I mean, there's huge differences between women and men. So, I mean, it really is quite a travesty in terms of advancing gender-based research.
Yeah, hopefully we're on the right track now, and there are a lot of women being included in clinical trials now, but it's also important now to look at differences between men and women when we're analyzing our data from clinical trials or just research in general.
Absolutely. Well, thank you so much, Dr. Rebecca Neville, for raising this issue. Obviously, a lot more research has to go into it. We hope that you are successful in convincing more scientists to look at things through the lens of gender. And thank you so much for your work.
Thanks so much for having me.